The Evergreen Media Network Studio, powered by Scott Tree Services.
Welcome to the Lori Davis Show, where it's all about the amazing lifestyle on our Treasure Coast. And here's your host and realtor for life, Lori Davis.
Hello, everyone, and welcome to the show. We are so glad you are here with us today. We have a great show. We have a wonderful young lady in the house that's going to spend some time with us and educate us on some things we all really need to know about. I'm Lori Davis. I am your realtor for life. I work with Dale Sorensen Real Estate. They sponsor our show. We are so happy. I always say that Vero Beach is a place, it's not just condos and homes, but it's about lifestyle. And, we have so many wonderful things that go on in this town. And this subject of our show today is in the medical field, because we do have some amazing, amazing people that are working and doing wonderful things. So we're going to get to that in a little bit. First off, I want to say, Cindy, how was your trip to California?
Fabulous. I didn't even. Let me get that ready.
Yeah.
Incredible. It was. You know what? I was there for 4th of July. I'm not going to give all the inside secrets about what I saw there, but there were a lot of fireworks there, and there were a lot of signs like north of LA that they were going to give out all kinds of fines, and I guess maybe some of that they did. We had a phenomenal time.
Yeah, good.
Phenomenal time. Good. Phenomenal.
Fireworks. Is it dry?
Everywhere.
I mean, that's why I worry about fireworks, right? Because they start fires.
It was dry. But the people were doing it, and I don't want to add them in certain places, whatever. They had some fire truck stuff there, but it was really, really, really hot. What they were talking about, yes, it was brutal.
Like the rest of the country.
106 degrees, literally on the temperature of the rental car. So that it was hot. And a lot of people don't have air conditioning. Saying like we don't have it. Mm-hmm. I was in the San Jose area. A lot of people don't have air conditioning, and there's no humidity, so you don't get the break of that, and there's no ocean breeze.
Gosh, yeah, no.
So it was hot.
It was hot.
It was hot.
Okay, well.
But we had a pool, so we were good.
And now that you're home, you get the tropical breezes. Right. So good to have you back.
We're
glad to have you. Thank you so much for joining us today. What's happening around town? It is the dog days of summer here, but, there's lots of things still to do. Riverside Theater, they are just going all out. They've started their Thursday night. It's Music in the Loop Summer Thursday. So it used to be Friday and Saturday. Now you can go out on a Thursday. They continue an eclectic night of music performed by local musicians playing in the Loop. This weekend also, they're doing a casino-style games in the lobby to benefit the children's programming at the theater. So from 5 to 8, you can be outside listening to music, or you can be inside and playing casino games. So what they do, I guess, is you buy casino dollars to play there. I mean, I'm not going to play with real money, but you'll cash in and you'll do that. So that sounds like a lot of fun. And go ahead.
No, I was going to say, we did a show on it yesterday or the day before, it doesn't matter. And you can go, you don't have to play either. You can go and just watch. You can have like a hot dog, hamburger, drinks, and just watch people play. There's a roulette wheel, there's blackjack, there's what's the slot machines, there's all kinds of stuff. Yeah.
That is cool. And now
it's totally cool.
It is Thursday, Friday, and Saturday nights, right?
And they're doing it they're doing it 2 weekends, I think.
Yeah.
And then the money is actually Riverside Theater money, whatever kind of thing. And then you change it in for a prize or whatever it is.
Okay.
Yeah.
Okay.
It sounded phenomenal.
I think it sounds great.
A lot of fun.
Because there's, we talk about things. It's kind of hot outside. Even if you're outside listening to music, go inside, watch it or play it or whatever. But they're doing the real deal. So I think
I don't know how to do it. You know what I mean? And I always want to just stand behind the people and watch them because I don't care about playing it. I don't just like root them on. So I might go over there and do that, have a drink or two, and just root them on.
Oh yeah, you can do. That's easy enough.
Yeah,
that's easy enough.
Yeah.
I like. Well, I just learned to play roulette. There's a couple easy bets that you can play, but I play craps. And again, I bet the easy bets. Okay. I learned one time, somebody taught me probably 12 or 15 years ago, and I could always go in a casino and I could always play, and they give you free drinks. So, it's kind of just entertainment, whatever.
Right.
I mean, I don't bet the mortgage and I don't lose, my purse or the shirt on my back.
Taking off all your rings and everything.
Right, exactly. No. But I do have a good time. Yeah. And then along with that, then on Friday and Saturday night goes the comedy club.
Right.
So you've got Music in the Loop, you've got the casino, and then you've got, so it's a triple threat. And then you've got the comedy shows, which are the 6 o'clock, is it 8 o'clock? 6 and 8.
They changed
6 and 8 o'clock. Yeah, shows
6 and 8. Yeah.
Yeah, and this week it's it's next week. It's Saturday because today we play on what day?
The 13th.
Yeah,
and 14th.
so it's next
the
weekend.
20th.
Yep, and it's Tim the dairy farmer. I don't know anything about this guy. I don't know. And Johnny B. So to see the comedian, you would have to pay $25 for a ticket.
Right.
So that's what that's all about. But there is so much to do.
Yeah.
And then I guess on the Murphy's Law is the band. Saturday's band is Jersey. I mean, there's just so much to do. So I really like that casino, what they're doing inside as an extra thing to do. And like I said, it's going to be from 5 to 8 over at Riverside Theater. So go on over. Again, get out of the heat, and it's done at 8 o'clock. You can be home, tucked in bed, watching your Netflix before you know it. Well, you want to go out and do something,
Right,
but I mean, Vero's not a late night town.
No, it's not.
So what you do there is, it's kind of get out and have a good time.
I want to throw out, too, that I went and saw the Kevin Costner movie, what is it, Horizon? And
yes.
It's going to be 4 parts?
Yes.
Oh, wow.
Did you like it?
Yes. It's a little tricky to kind of follow. Very graphic.
Okay.
Very parts
What is
gory and
what is
graphic.
the subject?
The premise of it is it is during the Civil War, but the first part was about expansion out west and how the people went out there and had their interactions, for a mild word, with the Native Americans.
Okay. All
Pretty
right.
brutal, pretty real to life.
Okay. And we've had one here so far, and then there's
It
3
just
more.
started. It started, I think, June 27th, June something here.
And that one stays for a while?
I don't know how long it's going to stay. It is
I'll
a
have that
3-hour
next
movie,
week.
but it goes fast. And then he's got 3 more parts.
Right. So I'll find out. I'll find that out, and I'll get that to you next week.
See it. It's worth it. It's not 5 stars, but it's...
Right. I can't wait.
Yeah.
And everybody likes Kevin Costner. He's had that resurgence of popularity since Yellowstone, right? Everybody loves him.
Yeah.
So, he's an all right dude. I don't know. He's not my type.
Me either.
Some of my girlfriends are like all about this. But anyway, he's very good. He's very successful. He's a very handsome man. Yeah. And he's doing great things. So we're very happy about that. Farmers Market, we always want to remember to go to the Farmers Market on Saturdays next week, guys. When you get there, it's going to be wonderful. It's 8 to 12. It's Saturday morning, Oceanside, just something fun to do. And then we'll always remind people about the Vero Beach Museum of Art, where they're doing the John Landau Sunset Strip billboard exhibit. Cindy saw that. It's fabulous. Yep. I haven't been yet, but my guest is like nodding her head because I think it's supposed to be a really good thing. Did you see it?
I haven't yet, but it's on the list.
It is on the list. You have to do it.
Yeah, you have to do it. Go.
Real quickly, DSRE by the numbers year to date. Dale Sorensen Real Estate. This is residential real estate only. 433 million, 525 transactions. We're holding at 19.4% of the market share. That's through 6 months of the year. That's through 7, 8. So the next closest is 319 million. They've done 351 transactions at 14.3% of the market share. So we're holding steady. We've held that on pretty much since the beginning of the year. I looked all the way at the bottom, and it's already $2.2 billion in residential real estate in Indian River County, and since January 1. $2 billion. That's just that's residential. I do not put commercial in there. I do not put land. I don't put. It's just residential. So it blows my mind.
Yeah.
We have a lot to buy and sell in this town. And if you need a realtor, remember Lori Davis at Dale Sorensen Real Estate, and I will help you out in the buy or sell of your real estate. Thank you, Chef Scott Baricchio from Citrus Grill House. He always provides us with a beverage. Today's beverage, we had a little snafu. And my original guest, who I'm going to send the show to, so I'm dogging you, I'm outing you for canceling on me at the last minute, asked for a dirty martini. So we have a fabulous dirty martini, and they wanted 3 olives. We have 3 olives. We have everything you need. Everything you asked for is right here. But thank you, Chef Scott, for the beverage.
Delicious as always.
It is delicious. We love it. Go see the Citrus Grill House over at 1050 Easter Lily Lane. They are open Monday to Saturday. They do lunch and dinner. It's wonderful. It's right there on the ocean, right by Humiston Park. Our guest is saying it's one of her favorite restaurants here in town. You can eat inside, you can eat outside, even if it's hot out. They've got fans. It's really quite nice, and it's beautiful. It's right on the ocean. So if you have guests in town, be sure to bring them over there because it's very, very impressive. It's always fresh. If it's not fresh, they're not serving it. Staff is wonderful. Thank you, Chef Scott, and go on over and see Citrus Grill House. Okay, on to our guest today. We have a preeminent vascular surgeon here in Vero Beach, and the practice has been around since 1990. It's called Vero Vascular Surgery and Vein Therapies. Dr. Clark Beckett is the vascular surgeon, but we are fortunate enough to have his surgical PA with us today. Welcome, Alyson Ryall. Hi, Alyson.
Hi. Thank you so much, Lori. I'm so happy to be here.
I'm so glad, and God bless you for being here. Kim Beckett, she's like, oh, Alyson would love to do it. Alyson's like, what? I'm in surgery. I'm going where after I get out of work today? Anyway, we're going to get you in and we're going to get you out. But we were thank you, really appreciative. And the practice that Clark has over there, and I mean, I call him Clark because we've known him so long, but you've been with him how long now?
4 years.
4 years.
Yes.
That's a long time.
Yeah.
Tell us a little bit about that practice and what they're doing over there.
Sure. It's an incredible place to work, first of all. So
Yes.
Vero Vascular Surgery, Dr. Beckett is an incredible surgeon. As a vascular surgeon, we treat arterial and venous disease. So I think, first and foremost, I think a common misconception with vascular is we're thinking veins first and foremost.
Yes.
But really, as a vascular surgeon, he addresses a lot of disease states that originate in our arteries.
Okay.
So that's head to toe, exclusive of the heart, because that would be your cardiac team.
Okay.
So carotid arteries in the neck, that's your area for stroke risk.
Yeah.
The abdominal aortic aneurysm, which is a really threatening, usually a silent killer. So a lot of these surgeries that he's doing and that I'm assisting him with are really things that can save lives,
Yes.
really technical kinds of things. And then arterial disease in the legs, which is really limiting to a lot of people who don't have enough circulation to
Right.
carry out their normal activities of daily life, whether it's exercise or errands, things of that nature. So
Right.
the arterial disease is the really serious, severe kind of side of the practice, where we're trying to get help to those who are trying to come up with a diagnosis for their pain,
Right.
or who are referred because of a finding by their cardiologist or their primary care. So a lot of these are outside referrals for a really particular problem.
Right.
And then the vein side of things is a little bit more common. I think people are more aware because varicose veins, obviously big
Yeah.
and ropey, we see them as a cosmetic threat, right? So we
Right.
want to get rid of those.
Right.
And then spider veins too. A lot of these things have more of a genetic component to them. They're not quite as dangerous, but
Right.
certainly can still implicate a person. And so we do treat those as well.
Right. Now, when people come in, like if you think about it, because carotid, I mean, I had a young friend.
Yeah.
I mean, she's younger than I am. Had to have that surgery.
Yes.
I mean, so this is not something just for older individuals.
That's
correct?
right. Yeah, that's a really good point. So we do see a really wide variety in ages. I think atherosclerotic disease is what it falls under. So a lot of this has to do with plaque. So the best way to describe it is, cardiovascular risk factors are one and the same. So somebody who has risk factors in their coronary arteries may have risk factors other places in their
Right.
body in the arteries. And so carotid artery disease, as you're talking about, a lot of times that's found due to a family history of stroke,
Right.
or people are having neurologic complications themselves.
Right.
And so, yes, there's a vast discrepancy in ages. And so when we operate on something like this, it tends to be in older populations, yes,
Right.
because that type of disease takes a long time to develop.
Okay.
So there's multiple risk factors involved,
Yeah.
the most common ones being smoking, diabetes, family history, high cholesterol, and blood pressure.
Right.
Yeah.
Right. So, I mean, that it hit my friend so young.
Yeah.
I was just floored. I
Right.
was
Well,
just-
it's shocking in that way because a lot of times the friends like that who are young who find that,
Yeah.
they don't necessarily have presenting symptoms.
No.
They might have had a screening ultrasound and all of a sudden they say, boom, oh my gosh, I had no idea that I
Right.
had this going on, because you don't necessarily feel differently if you haven't had a stroke.
Right.
But if you have that finding there, then typically you are referred to us so that we can start to, come up with a plan to either observe that with ultrasound routinely or help you to mitigate those risk factors so that it doesn't grow into a surgical problem.
Right.
So oftentimes it is kind of shocking to patients when they find out.
And now, do you ever find when you've got somebody that comes in and maybe you see something arterial, like here, or like you said, abdominally
Right.
or legs, can you treat that with therapies other than surgery?
Yes. So there's a lot of ways to try to treat from a medical standpoint. So addressing risk factors, we're thinking about when a patient comes in, what are those risk factors? And then looking at what are they already doing? Are they already on a statin therapy to try to address their lipid profile? Can they eat a more heart healthy diet? Are they exercising? You know, all of these other things that can definitely be part of a proactive healthy lifestyle all start when we're young. So trying to do those things now to avoid those complications, or knowing your family history is so powerful, right? Knowing if you've had risk of stroke in the past, or, you know, if your grandfather has had a stroke, maybe you're starting some of those lifestyle changes now. But definitely, I think it's important to focus on those things when our patients come. Although being that we're a surgical practice, a lot of times these things do become surgical problems. And so, you know, we're trying to definitely be proactive in doing the things that we can to avoid surgery, which is, you know, reassuring to our patients. But a lot of that comes with, you know, once you have this diagnosis, it's something that we're going to follow regularly for you to kind of take that anxiety off of your hands and look at it regularly with ultrasound.
So people are coming in, so they're not all, I mean, they get referred to you because they're at the point where surgery might be imminent. Yeah.
So referrals come in two different ways. So sometimes a primary care physician is doing a full physical exam, and let's say you're a healthy individual, but they're listening with the stethoscope to your neck and they say, oh, that doesn't quite sound right. That's called a bruit. And a bruit is an abnormal sound that you can hear in the blood flow in your neck. So sometimes we get a referral from a primary care physician looking for a baseline ultrasound to say, you know, how significant is their disease, if anything. Mild, moderate, severe, and then we can go over that and make a plan for that patient. Whereas another person may see a cardiologist already, and they know they have some degree of, you know, cardiovascular disease, and the cardiologist is the one who orders a baseline carotid ultrasound. Ultrasound, I keep mentioning because that's the best screening tool.
Non-invasive.
It's non-invasive. Yeah, great. A really good tool. Thank goodness. We don't have to go through the MRI tube, or, you know, the ultrasound is the best screening tool. So let's say a cardiologist finds this disease. Well, a lot of times our really great cardiologists here in town, they are perfectly, they're perfectly capable of following that to a point. And then if it becomes severe, typically then they will get referred to us because that is technically, you know, kind of imminent to become a surgical issue.
Exactly. Now, we wanted to talk about, it's not just about arterial disease, but there's also a part of this that goes into veins, right? Because those are the big ones. And then we go into the smaller ones. Tell us about that part of it. Because that is a part of your business, isn't it?
Absolutely. So the way that we kind of run our clinic is we have kind of split days, or at least we try to. So on Tuesdays and Fridays, we see a whole lot of vein patients. So if people call, they can call for a self-referral and say, you know, hey, I have varicose veins, which sometimes it's hard to identify whether you've got varicose versus spiders. So the best way is, a lot of times the varicose are like the big, ropey, bulging type of veins. They can be symptomatic or not. They're not necessarily dangerous to you, but we have many procedures that we can offer to help address them, because nobody needs to be living in pain. So oftentimes these vessels become big, and therefore blood pools in them. When blood pools, we get aching, we get discomfort, and there are definitely ways to treat that. And it's an in-office procedure. So we do that. And then the spider veins are the flat ones, but the flat ones that are really discolored, sometimes it looks like you've got little scattered bruises on your legs. You know, we live in Florida. We like to be at the beach. We like to wear shorts and dresses and things. So people are often coming in thinking, oh gosh, I wish I could look a little better in my sandals, or I wish I could wear shorts. I only wear pants. So these, again, are not necessarily dangerous to you by any means. They're genetic, why we have them in the first place. But we can treat those as well. Injections in the office help to dissolve some of those veins. So we do that as well.
That's amazing. Listen, we need to take a break. We have to take a commercial. That's how we pay for this show. We'll be back in a little bit with Alyson Ryall from
Verovascular surgery.
Verovascular surgery. I always want to say veins in there, but it's verovascular surgery. We'll be back in a minute. See you in a sec.
It's time to call Easy Brew Coffee and Bottled Water Service and learn just how much you can save and how convenient it is to have your coffee and bottled water delivered right to your home or office. In addition to water coolers, Easy Brew offers individual bottles of water in 8 or 16-ounce bottles. No more lugging it home or dragging it into the office. Serving the Treasure Coast for over 2 decades, 2 letters, 1 simple name. Easy for Easy Brew. Visit e-zbrew.com or call 800-792-3285. Easy Brew.
Hey you! Host your very own show every week at Evergreen Media Network in Vero Beach. Go live to YouTube and Facebook with up to 4 people and your very own producer. Be heard on more than 15 podcast platforms and local radio. All you have to do is show up and talk. Your guests can join from anywhere in the world. It's easy to get started with the largest podcast studio on the Treasure Coast. Contact Evergreen Media to tour the studio.
At Sunshine Furniture, our 35,000 square foot showroom is filled with the largest selection of in-stock coastal furniture on the Treasure Coast. Dining and bedroom sets, occasional tables, sofas, sleeper sofas, love seats, and chairs in all the latest styles and colors from Tommy Bahama, Lexington, Hooker, Riverside, Universal, Four Seasons, Braxton Color, and Capri. We're the outdoor furniture experts and have hundreds of styles of any patio furniture you need, including a gallery of Berlin Gardens, Hollywood, and Kingsley Bait. We specialize in fire bits, outdoor rugs, umbrellas, and replacement cushions. Right now, we're having a super summer sale with lots of great markdowns and discounts on everything you need for your Florida home, including all pictures, lamps, and accessories are half price. Sunshine Furniture, $12.95 US 1 in the Publix Plaza, Vero Beach. Don't forget to visit our outlet store directly across the street and visit our website at sunshinefurniturecasual.com.
Sunshine Furniture.
Hello, and we are back here with Alyson Ryall from Vero Vascular Surgery. Okay, just in, we just literally found this out today. It's as reported in Newsweek magazine, Dr. Clark Beckett as one of the top 200 vascular surgeons in the country based on his Medicare outcomes. Top 200 in the country. That's amazing. What a great success. Tell us a little bit more about what that all means.
So I think the best way to summarize that is that as the small town that we are beyond lucky to have this man in our town. He is incredible. This just add to the list of all of the accolades that he deserves. He is just one of the most incredible people to work for. But this honor comes from how incredibly technically qualified he is as a surgeon. He is an artist, honestly. Vascular surgery is really technically difficult and really, really fine and detailed. I mean, if you're thinking like angel hair pasta size for vessels and sewing with the tiniest little needle the size of an eyelash, I mean, it's incredible the skill that he lends to all of the things that he treats in this town. To help provide these incredible outcomes for people who are really in a kind of a scary place. Yes. They are diagnosed with these diseases that are surgical problems because they're not reversible. No. When they reach a certain point, you can't take a magic pill. You know, it becomes a surgical problem to actually get rid of plaque that causes trouble, like I said, from the neck down. And so, I mean, he is just one of a kind. Like vascular surgery in and of itself is a really niche type of specialty. Okay. So he is so incredibly qualified. And not only that, but he was trained by these surgeons who have surgical instruments named after them. And he is directly trained by these people. There's not that many people left who can say that. And he has these incredible stories to offer from that. And I just personally feel very humbled every day to be able to work alongside him. He is an incredible surgeon, a wonderful boss, an incredible family man. He's a wonderful Christian. I mean, he's just... I can't say enough. The whole great. Package. He is. He's the entire package. Which, I mean, I think we all know is very rare in the realm of surgery, right? Yes. Sometimes you get some
prima donnas. You get
and
that whole
there's
thing.
No ego involved here. We can say enough things about him to where if he ever listens to this, he's going to be blushing. But I love to speak on his behalf because I just think the world of him. And if you ask anyone in this town, you will get the same answer. And that's when you know that's a quality human being.
Absolutely. You know, he's the only name in town that I ever hear for vascular surgery. I mean, everybody knows.
And it's from the security guard at the hospital to the person who works in the cafeteria to the nursing staff to the surgical techs. I mean, it does not matter where you are on that totem pole. Yeah. He is just a genuine person. That's fantastic. His skill is unmatched.
I love it. Alyson, thanks for being here. By the way, Alyson was trained, you guys studied at the same school?
So training in Birmingham, Alabama.
Okay.
Yes, the same.
Fantastic. So you're going to get the same great care from Alyson Ryall. Thank you so much for being here today.
Thank you.
I mean, at the last minute, we loved having you today.
Oh, it was a pleasure.
We'll have you on again. But listen, there is nothing better than knowing that we have some of the top surgeons in the country here in Vero Beach, Florida. Dr. Clark Beckett at Vero Vascular Surgery is here. We can't wait for you guys. If you need him, call him. If you can't find him, call Lori Davis, and I'll take care of it. Thanks again for everybody for being here today. We'll talk to you soon. Bye-bye.